data on the extent of the shortage varies based on where a family lives or whether a child needs a specialty formula or a specific type or brand. So some regions have been hit harder by the shortages than others. And disturbingly, low-income women and children who rely on the...
Where was the Biden administration plan to deal with what should have been a foreseeable event? We did not see a plan on February 17th or 18th or March 1st or even in April. In fact, the FDA did not even conclude its follow-up inspection of the Sturgis plant until March 18. And it wasn't apparent until mid-May that the FDA and the Biden administration took this issue seriously and began to act. Why did it take an onslaught of national media attention for the Biden administration to act with the sense of urgency that is required to adequately address an infant formula shortage?
As soon as we received positive Chronobacter results from environmental samples we collected during the inspection, we contacted Abbott to ask the company to issue a voluntary recall. The need to make urgent action to protect the most vulnerable of all of our people, infants, presented a dilemma. This was the largest plant of the dominant manufacturer, and it was the sole source of a number of metabolic formulas essential for the viability of infants, and with no substitution possible because Abbott had no backup plan. We knew that ceasing plant operations would create supply problems, but we had no choice given the insanitary conditions. First, FDA's timeliness of interviewing the whistleblower and getting into the facility for a for-cause inspection were too slow, and some decisions in retrospect could have been more optimal. This supply inadequacy did not happen overnight. Across the industry we regulate, we are seeing evidence that the just-in-time distribution system, market concentration, and sole source contracting are leading to shortages. Multiple reports to Congress call for improved supply chain management. Until regulatory agencies have digital access to critical supply chain information and personnel to do the work, we'll continue to react to supply chain disruptions rather than intervening to prevent them.